Hey y'all, it's Allie. I am back with another video. So today what I really wanted to talk about was mental health throughout the journey of my mastectomy, as far as things that I had been feeling going through the motions and going through the journey and things like that, and just some kind of feelings I had before, during, and after. If you haven't watched my last video, I'll just recap really quickly that um, I did have a prophylactic bilateral mastectomy, so it was an elective choice for preventative surgery for breast cancer. I'm still in the journey. I have done the removal with tissue expanders. I did reconstruction as far as taking the tissue expanders out and doing a fat transfer from my abdomen into my chest. And then hopefully, he said in May, just depends on what's going on with COVID, that I will have a scar revision and then also fix a few things that need to be tweaked a little bit. So I'm still in the journey. I'm still going through it. It's been a long journey. For some reason, I didn't think it would take as long as it has. I think it took a lot longer because of COVID. I was kind of stuck with tissue expanders in my body for about 10 months rather than just a couple of months because of COVID. And that was really hard. So I guess I'll just give a little background story on my chest. I don't know if that sounds funny or not, but basically I had weight loss surgery. At my heaviest weight, I was 320 pounds, and so far I've lost I would say about 150, 170, just depends. I've kind of gotten some regain, so I'll talk about that in another video. But when I was at my heaviest, I was a large D. I think I was a 44D as far as my bra size goes. After my weight loss surgery, my breasts kind of like just disappeared. I called them skin pancakes. It was literally just like a flat piece of skin with like a nipple at the end. I would say I was a B cup, and that is even with a lot of area left over on the top of the bra, because it was just kind of like a pool of skin and fat, and then the top of the bra was just kind of hollow. So yeah, I was overweight most of my life. So going from having a larger chest to losing a lot of weight and then end up really not having anything except for skin and a nipple was interesting. That being said, when I did decide to just have them removed and have reconstruction, I knew that the outcome of whatever cosmetic wise would be better than what I already had. But still, that was very hard to think about because I did choose to have the mastectomy and have my nipples removed as well. And it was just hard mentally trying to think about taking that part of my body away, as far as like functioning breasts and a nipple. It was just a hard thing to wrap my brain around and be prepared for and be ready for. So I did have my diagnosis about 5 or 6 years ago, and I just last year decided to have them removed, and I was ready to do that mentally. And just like the identity of being like a woman, you know, you have breasts, you have your own nipples and things like that. That was just really hard to think about having, like not having. So I do have some pictures of what my chest looked like before. I don't know if I'm going to insert them or not. Obviously, I'm going to blur out some things because I'm not trying to like show my whole, even if it's my whole old chest to the world, but I can insert some pictures. I did take a lot of pictures when I had the mastectomy, and after the reconstruction, I did have a lot of pictures I just kept for myself. And then also I thought maybe if I did end up making YouTube videos someday, I can share them with you guys. I really didn't know what to expect as far as what the outcome would be. I did try and use Google to get an idea, but there wasn't really a whole lot of images or anything I can really reference to. So I think as long as some people are not squeamish, I am going to insert some pictures of what my chest looked like immediately after the mastectomy, what it looked like throughout the inflation of the expanders, and then what it looked like during my fat transfer with my reconstruction and the expanders removed. I do have a lot of scars, and that's part of the scar revision. That'll be the next phase. And to be honest, I'm not really like too worried about it. I'm not trying to be topless. I'm not trying to like, I don't know. I'm going to be clothed. I'm a clothed person. So I'm not really worried about other people seeing my scars. And my wife is really supportive and she doesn't care about that kind of thing. So I'm not self-conscious about it. But anyway, I will say after I woke up from my first surgery, which was the removal, the mastectomy with the tissue expanders put in, I couldn't really see what was going on for, I want to say like a week and a half. When I woke up, I had a bunch of bandages around me and a bunch of tape around me. And I'll insert a picture, but it was kind of like bandages here. And then there was like bandages made into like a halter top almost. And it went all the way down to like my pubic area. And so I didn't get to see what was going on underneath until I had my follow-up appointment, like I said, about a week and a half later with the doctor, and he took it off just to see how things are going. I remember looking down and I did have some little lumps. There was something going on there, so that made me feel good. He did do the expanders with them half filled. So when I got them put in, they were half filled, they weren't empty. So I think that's, obviously why I had a little something going on down there. So that didn't really I don't know, freak me out, shock me when I looked down when I woke up from surgery. For the surgery, I'm trying to think, how long was I in the hospital for? I think I was in the hospital for 3 days and 2 nights. Of course, that stuff's kind of blurry because I was out of it. I was on morphine, that kind of thing. It felt like, I'm trying to think, what did it feel like when I woke up? There wasn't a lot of pain because, again, I was on a lot of medication, but it just felt really heavy, really tight, and felt like I had something pushing down on me. My pectoral muscles were really, really sore. Like it felt like I was trying to do like push-ups or something, and like it was just super sore right here. They gave me a little care package, which I should have brought with me, but I didn't, but I'll do that in another video. But it was like these little armpit pillows, and you just stick them under your arms just to kind of give you some support. And those worked really well. So if you don't have Kaiser and they don't provide that for you, I would really recommend getting these little tiny, like they were probably about that big, like pillows, and you just stick them under your armpits, and it just kind of helps alleviate some of the pressure on your chest. Like I said, the expanders were half filled when they got put in. By the time I was able to see what was going on down there, and when he took off all the bandages, they were kind of square, which was really weird. Like the tissue expanders were just like kind of like this shape at that time. So I felt like I had like two, like, I don't know, like pieces of bread or something. And then I did have a sports bra, and I bought a sports bra from Walmart. That was a cotton one, and it had like hooks that went up here, so you just hook it in the front. It didn't really fit too well because they were only half filled, so it was a little bit bigger, but when I went in every couple weeks to get them inflated, the bra would fit a little bit better. When I went to my consultation, the doctor had asked me what size I wanted to be, and I said I wanted to be like a large C cup. So that's what kind of we were aiming for. And he advised me to buy a bra that I would want to fill as far as like the space goes. So when I got to the size I wanted to be and the bra fit me the way I wanted it to be, then we were kind of done expanding. I will say that that was interesting because tissue expanders are extremely thick, like extremely thick. Like they are, not to scare anybody, but they are super duper uncomfortable. They're not round shaped. You know, if you took everything out of your breast and you have this like, feels like almost kind of like Tupperware, like rocks on your chest, you know, obviously your chest doesn't sit in a bra the way that fat would. So I did find a bra that I liked and I tried it on. And I was like, okay, yeah, it'll fit like this. And then, I don't know, you get the fat put in and then it sits differently. So that bra actually did not end up fitting me when I was done. My breasts were a little too large for it, just because of the way that breasts sit naturally rather than having Tupperware in your chest. The day of my surgery, the doctor, for my reconstructive surgery, when I had the fat transfer and the expanders put out, the doctor was marking me up, and then he was saying, you know, again, like, what size did you really want to go with? You know, just so we were on the same page. And I had boob greed, and I said, I think I want to do a D. And I had enough abdominal fat and my pockets were big enough for him to do it. So he's like, okay, like, we can do that too. I am not upset with my surgeon. I like the size chest I have, but I have bought several bras since the reconstruction and since I've healed, and different brands, different places, and it turns out that I am a double D now. So I went from wanting a large C to asking for a D, and then eventually it just became a double D. So that's what I'm working with now. And oh, also I forgot to mention, it is really weird when you get your bandages removed if you decide to have the mastectomy with your nipples removed, because you just like look down, you look at it in the mirror, you look down and there's like no nipples. It's really weird. It's kind of, it's a trip. I wasn't like devastated or sad or crying when I saw it, but I was just kind of like, oh, okay, like I don't have any nipples. So it is really nice to have nipples now. I mentioned in my last video that I also had a tummy tuck with my reconstruction surgery. So with the extra stomach skin that they took off, they made me nipples. So I do have nipples. They're flesh toned right now, and eventually I'm going to get them tattooed a color, like a nipple color, after my scar revision and after I heal from that. So with that, with my last surgery of my reconstruction, I did have 2 drains. I had 2 drains when I had my mastectomy too. It was one on each side of my breast pocket. And then for the reconstruction, I also had 2 drains as well. Basically what I have as far as scars go, and they just cut open the same scars from the mastectomy. So, sorry, I'm gonna like show you my chest. So basically when he did the mastectomy, what he did, let me see if I can make this even lower. Sorry, you're gonna see my setup. I'm sitting on a mat because I'm old and my back hurts. So basically he has, I got cut from all the way across. So it's basically like a straight across incision. So this whole part was open, cut open. And then I have a line that goes up to here. So I have a scar here and I have a scar here. And then when he made my nipples, obviously I have like a circular scar right here. And then the nipples were made. So scar, cut, and this part were done during my mastectomy, and he just recut into those same scars when he did the fat transfer. I will say when I woke up from the reconstructive surgery, I wasn't all bandaged up like a zombie or like a mummy like I was the first time. So I just woke up and I had the hospital gown on and nothing, just like, you know, some little bandages in certain areas, but I just looked down and I was like, oh, okay. They were extremely swollen. They were probably like almost like not twice the size they are now, because that's a little extreme, but they were really, really, really swollen. And then also the nipples, I had done a little bit of research, and the little bit of I did find actually did say your nipples are going to be start off really long, and then they do go back to like a smaller normal size. So I'm glad I saw that. And then also I was lucky enough to have one of the head nurses who was taking care of me when I woke up. She actually went through the same exact surgery I did. So she saw my face when I looked down, and I saw, like, I'm not even exaggerating, like my nipples were like, they were probably like that long. And I looked down and I was like, okay, like those are some big nipples. And she's like, oh, don't even worry about it, like they'll go down. Actually, one of the things that is a common that needs to be fixed is they'll go down so much that they'll be flat, and so kind of like your nipple disappears. I will say my nipple is pretty flat. It's definitely not as long as it was, but it's not like completely flush. Like you can tell there's a little bump there. So that was interesting, waking up from that and looking down and seeing like this, like it felt like, I swear to God, it felt like my pinky was like my nipple. But it does get better. It does go down in size. You're not going to be stuck with like these extremely long nipples. I don't remember how long my first surgery was. I think my first phase of surgery for the mastectomy was like 4 to 5 hours. And then my reconstruction surgery was 12 hours because it did include also the tummy tuck and the fat transfer. So that's why it took so long. I woke up, I was not in pain. I was on a lot of medication between the IV, whenever they were giving me my IV and whatever. And then I also had a morphine pump, which I used the hell out of that thing. It was just sore. Again, it was just like the same type of like muscle soreness, and, you know, just got cut open, so it hurt. I was in ICU, which was, I already knew I was going to be in ICU. It wasn't like something went wrong and I ended up in ICU. I already knew I was going to be in ICU when I woke up. So I was in ICU for 3 days. And then after that, I was moved into like the general post-surgery section for 2 days. And then I went home. So I was in the hospital for like 6 days. I was really sad because my wife couldn't be with me. She couldn't even visit me. Like when I went for the surgery, she was able to come into like the little waiting room, but she couldn't be back there with me. She had to leave. Basically, I didn't see her again until she picked me up. We talked on the phone and stuff, but because of COVID, she couldn't be with me. So I was by myself. I wasn't completely by myself. Obviously, I had nurses and stuff, and they took really good care of me, and I had all the support I needed with them. So that was good, but I just missed not having anybody with me and not having my wife with me. That sucked. So yeah, looked down, saw my pinky-sized nipples and these huge globes because they were extremely swollen. It's crazy because one thing I didn't notice, because I had so much tape and like bandages in certain areas, that I didn't even realize until like a couple of days later that what had happened was, or part of it was, I guess another like high risk thing that can happen is you can get like necrosis of your nipples, like the skin they put on, if it doesn't get the adequate blood flow. So what I had when I looked down was like a bunch of like tape and like some bandages right here. So I didn't even notice that was there until they took that off a couple of days later. But what it was is it was like 2 wires. There was like a wire in the middle in my cleavage, and that was actually stapled onto my skin. There was like 5 staples onto that, and then they put like a bandage tape on top of it. And then there was these 2 wires that went this way, and there was 2 wires from it that went this way. And they went into my nipple, like where my nipple was sewn. So I had wires going in here, wires going in here, and it had part of the part that was taped to me had like these outputs, like they kind of look like auxiliary outputs, which was weird. And they had this machine that they would bring in, and they would plug plug the cord from it into those outputs, and that's just to hear, I guess, the blood flow from my nipples. So that's how they were able to tell that like I had adequate blood flow. I thought that was really weird. I remember it sucked to get removed because I think it was like the day before I left, they took those out. And so like, I mean, it was like a medical grade. It wasn't like Office Depot, but they used a stapler remover to get rid of my staples. And then they were pulling out like these little, it almost looked like dental floss. Like that's the kind of wires I mean. Like it wasn't like a black, thick wire. It was like dental floss size wires. And they pulled those out, and that was really weird. But yeah, that was part of it. That was interesting. I'm trying to think of what else. I came home after about 5 or 6 days in the hospital. I was off of work for almost 2 months. I want to say about 7 months. 7 weeks. The healing from the mastectomy wasn't hard. As far as like pain goes, the drains were annoying. I hate the drains. Like I hate the drains. I wish that you didn't have to have them in that long, because they're just annoying to have to clear out and carry around. And I actually bought a cheapy fanny pack at Walmart, and I made sure that it was big enough because I knew from my tummy tuck and from my breast that I was gonna have 4 drains. So the bulbs are like, they're like that big. So I made sure I got a fanny pack that was big enough to put all 4 in there. So I just was like chilling at home in my pajamas with this fanny pack on and all my bulbs stuck in. So if I wanted to get up and walk around, go to the bathroom, I didn't have to like hold them and worry about, dropping them and flying out of my body. Like I know it doesn't do that, but you never know. So that is a tip: buy a fanny pack. Buy a cheapo, large enough fanny pack to stick your drains in, because that will help so much. But as far as recovering from the mastectomy goes, that wasn't too bad. I just kept it clean, made sure I put put some Neosporin on it, didn't touch it barehanded. If I did touch it with my bare hands, I made sure I like washed my hands before. My wife would help me put some stuff on them. She would wear gloves. I would wear gloves if I put the Neosporin on it. The recovery wasn't too bad. The worst part was the tummy tuck, because you can't stand up straight for like a month, a little over a month, just so you don't rip your incision and also your abdominal muscles. I did get a little bit of muscle repair as well, so they did tighten my abdomen muscles because they were really far apart from being overweight for so long. So that was sore. You're basically standing at a 90-degree angle. Like when you get up, I had a walker. They were going to provide me a walker if I didn't have one, but I already had one, which you do need, because you are literally hunched over trying to go to the bathroom or trying to do whatever you need to do when you get up. The tummy tuck pain and the tummy tuck incision was a lot more painful than the mastectomy as far as recovering from those wounds. The only thing I had, which I would say is kind of a complication, but not really, is my right nipple, like where not the areola, but like the actual like nipple itself. I was noticing underneath it that everything else was healing and like attaching itself and turning into scar, but there was like this open flap, and it was like I could like lift my nipple up and look inside of it. I don't know if that's, sorry. I can kind of like lift it up and look inside of it. Sorry, my phone is telling me I have low battery. And so I was like, okay, this isn't good. So I sent my doctor a message, and he went to look at it, and he just had to put a few stitches there to hold it in place and to get it to heal like that. It did. It did take a little bit longer to heal than the rest, but it did eventually do that. The only thing I'm going through right now in between waiting for my scar revision is on my left breast. There's like a little bit of puckering where he made me an areola, and unfortunately like the tiniest piece of that like is kind of open. it's not infected, it's not like bleeding or anything, but like you can kind of like pull apart like where the breast pocket is and the areola, and it opens. Like I said, it's the tiniest little thing. I've sent pictures to my doctors. I've emailed him and he said it's fine. He goes, honestly, it's not going to get fixed until we do your scar revision and we can, you know, sew it that way. So that's where I'm at with that. Hopefully in May, I will get my scar revision, and then also I do want to have this nipple fixed because underneath of it was where it was like kind of flapping open and he had to put more stitches in. It kind of healed like downwards. So this one is fine. This one is facing the right way, but then when I'm topless, like this one is kind of facing down. And it's a tiny thing. It's not like anything that I'm extremely upset about, but if it can get fixed, might as well get fixed. I know I've pretty rambly and all over the place, and I'm still gonna make more videos about mastectomy. I don't feel like I really went into mental health that much, and I really would like to continue on with that. But I'm gonna end this video for now. It's already at 27 minutes and I'm gonna have to edit it a lot. I'm gonna try to insert some pictures while I'm talking. So just bear with me because I have never done that before. So that'll be a first for me. But anyway, thank you for listening to me ramble. Thank you for watching. If you do have any questions or anything like that, please leave it in the comments below so that way I can address them in my next video. But anyway, thank you so much. Have a good day, guys. Bye.